I have a 39-year-old who is presenting with chronic lower extreme lymphadenopathy, no known cause so far, and then he's also suffering from severe edema and now has an ulcer on the left lower leg with possible cellulitis. Patient now is in long-term rehab with wound care. BP was initially 148/60, otherwise good vitals. Patient is 376 pounds, 70 inches, BMI of 54. His 24-hour daily recall was overall relatively good. He had cereal, skim milk, cottage cheese, Nutri-Grain bar in the morning, a Subway sandwich with an apple and Diet Coke, mini pretzels, and banana pudding. And then for dinner, a boneless, skinless chicken breast with kale water pudding, a cup of blueberries, and a cup of popcorn. The admission note was that the patient is at high nutritional risk because of the ulcer and the draining wounds. Mobility listed as very limited, nutrition listed as adequate. Recommends position changes in cushion while in wheelchair. And then the patient is being managed with complete decongestive therapy, but it has not been effective. Multiple episodes of cellulitis with multiple rounds of antibiotics. The primary doctor is positive that the ulcer and cellulitis is exacerbated by his weight, although they do not otherwise know the cause. Has a history of hypertension and hyperlipidemia, potential familial history of heart problems as well. The PCP wants a dietitian consult with a low salt, low fat diet. The labs for the patient, the CBC monocytes were slightly elevated, showing us that there's a recent infection that the body's immune system is working on creating inflammation for. The hemoglobin and hematocrit were both low, signifying that the patient has low carrying capacity and anemia. His segmented neutrophils and band forms were low, showing that he has a reduced capability for wound healing, and this can lead to persistent ulcers. This might be why the treatment he's been receiving for the last few of his times have not been working very well. His CMP he had a low protein level, which can be associated with poor healing ulcers due to impaired immune function. And then he also had, he was at high nutrition risk because of his ulcers. Patient's diet is important in decreasing overall inflammation and obesity that can exacerbate healing. The fat tissue surrounding his legs could also be causing fluid buildup to cause the edema, so making sure he's eating correctly, that would help reverse those issues. We want to ideally reduce sodium intake to manage fluid retention, plenty of water, and lots of fuel to fuel the higher metabolic demand of fighting off infection. Based on the 24-hour dietary recall, he actually eats quite conscientiously. He seems to be swapping out higher calorie versions of dairy and fat for skim milk and wheat versions. Overall, it looks promising. Based on his recall, he's probably eating about 2,000 calories a day. Very low in calorie, but also very low in protein. He needs to get more complex carbohydrates for complex carbohydrates for fuel for longer. His total daily energy expenditure for someone of his lifestyle would be around 3,000 calories a day. So right now he's eating in about a 1,000 calorie deficit. Assuming the goal is weight loss, the patient's calorie range should be appropriate, but he just needs to change the sources of foods that he's eating. So we want to change those to more nutrient-dense foods, low inflammatory, low sodium, low in fat, so that we can continue to lower inflammation in the body. I would recommend 100 to 120 grams of protein a day, 60 to 100 ounces of water, 8 hours of sleep, low stress, a movement plan to continue working with the blood flow. We want to shoot for high volume foods, grains, plant sources, and then no processed foods, limiting refined sugars. The weight bias I saw was the primary care provider states in his physical note that all of his symptoms are exacerbated by the patient's weight. He states specifically that the treatment from his clinic is no longer working, even though he has seen this patient multiple times for cellulitis and lower leg edema. Complaints associated with patient's signs and symptoms seems to be disregarded because of his weight and stigmatized by the provider. It seems as though the intake coordinators of his care wrongly associated the problem he came into the emergency department for because of his weight. Based on the impression I got from the 24-hour dietary recall, it shows me that he is managing his diet as much as he can. So I would want to speak to that provider and speak to them about any additional tests that they've done. I would want to understand how the provider intends to manage the patient's hyperlipidemia beyond the simvastatin. Does the patient have any labs that would be suggesting of an endocrine issue? Has that DVT ever been suspected? Any other carrying capacity issues, anemia, anything like that? And I would just want to speak to that provider and make sure that they understand that this is something that can be treated differently than just obesity. For treating the patient and speaking to them, I would want to be extremely compassionate and also just be very reflective, because he obviously is already taking priority of his health and his diet. We want to continue with healthy alternative swaps to his foods. Besides the dairy, we want to continue with that. And then preventing any backsliding. We want to see how his family and friends support is based on how he surrounds himself with food. If the people in his life making food for him while he's recovering are, adding excessive oils and things like that. I want him to continue to be very motivated and see how much progress he's already made, if he's already making those changes.